It's a disease that affects as many as 200 million people worldwide and can lead to scarring of the liver and ultimately cirrhosis. Joining us this morning with important information about hepatitis C is Robin Bennett, founder of Robin's Haven of Hope, Melissa Boykin, a transplant recipient, and Sharon Raymond with the Louisiana Organ Procurement Agency. Thanks so much for being here this morning, ladies.
Thank you for
having us.
So first of all, for people who may not know, what exactly is hepatitis C?
Well, hepatitis C is a blood-to-blood disease. It's blood to blood. Your blood touches someone else's blood. That's how it is. It's a blood-borne disease.
And Melissa, tell us a little bit about your experience with your transplant.
I had my transplant due to complications from a medication that I was taking that a tumor developed and ruptured in my liver. And after extensive testing on my liver for 3.5 years, it was decided that I needed a transplant. And so because of the lack of organ donors and education here in Louisiana, my liver came from Florida. And so, and then I have a sister also that had a transplant, and hers came from Chicago. So after the tumor ruptured and having all that tested, it was determined that I needed a transplant. And I got on the transplant list in July of '93 and received my liver on Thanksgiving Day of November of '93. So this Thanksgiving would be 21 years.
Well, congratulations on that.
Yeah.
Robin, you're not from this area, you're from Houston, but you've traveled here to help people. Tell us a little bit about that.
Okay. Robin's Haven of Hope was founded by me, Robin Bennett. It was to help bring awareness and education to the African American community and remove the stigma and the myth about this disease. And I brought help here through the pharmaceutical companies. We did a health fair at Hattie Perry Park. We had a 10.4 positive rate. So I contacted University Health, and I'm working with Miss Dana in the Hep C clinic. So now she has opened up the clinic to the people who was tested at Hattie Perry Park. And I got resources through Partnership for Prescriptions. I got resources through Need More Meds. I got resources through Gilead and GlaxoSmithKline. The most important one was Merck and GlaxoSmithKline, because when you have hepatitis C, you will have hepatitis A and B. But in order to not have it, you have to be vaccinated. So Merck and GlaxoSmithKline says if they use their vaccine, they will replace it for free. If people do not have money, you can get all these resources free. And I almost said LSU, I mean University Health Hospital, all you have to bring is your Louisiana ID and a proof of income. And if you live out of the state of Louisiana, all you have to bring is $200, and you know, they'll see you there. But everything is provided for you free. But first, you must get to the primary care doctor, and that can bring down the staggering numbers, because Louisiana has a staggering numbers, 25% mortality rate and 150 deaths per year.
Sharon, what do you want people to know about transplants?
I want them to know that this is something that can save lives. It can save up to 9 different patients by one person being a donor. It's so easy to sign up. They can register on their driver's license by saying yes to organ and tissue donation. They can sign up at our website at lopa.org, or they can come out to any of the health fairs that we have available, as we were at Hattie Perry Park 2 weeks ago, and we'll be at Cinco de Mayo tomorrow for a health fair.
Great. Ladies, thanks so much for joining us to talk about this important disease that people need to know about. Important information. Thanks so much.
Thank you very much.
Thank you.
Stay with us.